good morning, and welcome back to Good Morning Tobago right here on Tobago Updates, guys. I am your host, Shenell Felix. I know whenever you see me sitting here, it's because we're about to have those conversations that you want to have while I ask those questions that you want asked. And this morning, we continue our conversations and topics. And one of the things to note is that we are continuing to celebrate Lupus Awareness Month. This morning, I have the privilege of chatting virtually with Miss Reeanna Harrilal, who is one of the Hummingbird Gold Medalist awardees nationally. Now, we want to say a special good morning to you, and thank you for joining us this morning.
Good morning, Tobago. Oh, how I love the Sister Isle. How are you?
We are doing fine over here. Now, it's Lupus Awareness Month, and you are president of the foundation called the Voice of Lupus, right? And you have also been one of those persons that have been battling with lupus. So, first of all, tell us a bit about some of the work that you have been doing as it pertains to the foundation.
So in 2010, I was diagnosed with lupus back in 2004, somewhere around there. And when I was diagnosed, there wasn't a voice of lupus to go to. And I dealt with my illness in a very hard way because when you think of lupus and you understand the disease, lupus is a chronic autoimmune disease, and it remains a significant health challenge, not just in Trinidad, but also in Tobago, and often under recognized and misunderstood. And individuals living with lupus face not just the physical toll of the disease, but also social stigma, limited access to specialized care, and insufficient public awareness. And back then, I was at the peak of my career in television. I'm a broadcast journalist by profession, and I would have been fired from my job and in 2010. And then the Lord spoke to me to start this nonprofit. It was actually a Facebook page in 2010, and then in 2011, my mistake. It's been so long. I would have been fired from a top television station, and the Lord said to me, "I want you to make this physical and make this Facebook page a physical entity." And I never looked back. It's been 14 plus years, and we've been doing a number of initiatives. And I've always had a heart for the Sister Isle because we are one Trinidad and Tobago. And in 2013, I started working in Tobago. I would have, done a lot of work utilizing a space at Penny Savers. The owner, Mr. Kirk Warner, would always allow us every month for almost 7+ years to come in once a month, and we would raise awareness, but we would also ask members coming into the supermarket who's shopping to give a donation so that we can provide a tangible support for those Tobagonians living with lupus who cannot work because of illness, and they're unable to provide for themselves and their families. So for many years, I'm talking about close to 7, 8 years, the organization would have been coming to Tobago once a month to bring awareness and to also, provide support and what have you. So my journey really came from personal experience and the lack of support. And, I transformed my home here in Trinidad into the Lupus Learning Resource Center, where I provide essential services such as medical assistance, educational resources, food support, etc. And over the years, we've impacted over 1,700 families here, offering hope and advocacy to those living with lupus. But my heart has always been, how to bring more awareness and also tangible support for those in Tobago. So I know you had two wonderful ladies on earlier, and the organization is standing in support with this support group because this potential initiative is a creation, and it's a creation where we can give those in Tobago a voice. Many lupus patients in Tobago feel isolated, they feel left behind because there's nothing really in place. I mean, we have doctors in Trinidad, but in Tobago, there's a disadvantage because there is one doctor, a rheumatologist, who comes once a month to provide that assistance to those Tobagoans living with lupus. And there is a lot more that needs to be done, and I'm so proud to see that there is a support group that's going to be launched to amplify the voices of Tobagoans living in Trinidad and Tobago, ensuring that they have access to necessary resources and support. And, we can work towards a future where no one faces this this disease in silence and alone. You know, I'm so happy. I caught the interview a little late. I heard that they want to empower patients, and that's the whole heart of it. Empowering patients to understand. Listen, despite having lupus, you can thrive. Despite having lupus, you can still pursue your goals and dreams. Those two ladies are testament that they can. In spite of living with the condition, they've been motivated well enough that they can stand in the gap and say, listen, we want to pioneer something. I mean, I've sown the seeds over the last how many years, but we really need the vehicle to push the awareness, to continue to be in the face of the authorities and even John Public. Because let me tell you something, there's a lot of stigma attached to lupus. There is a lot of stigma. I remember when I used to be there so actively in the years gone by, we had men who live with lupus coming and telling me, they used to call me like a sister. And some of them would call me a mother, and they would say, mother, people think I have AIDS. People think I have, it's leprosy. People think it's a type of cancer. So there's a lot of stigma associated with lupus. And I'm really happy to see that there is going to be change for awareness, because listen, how can you say you don't have lupus if you do not know what it is? And I think the awareness is very critical, education is very critical, and we need to support each other.
Right. And there are instances where persons have lupus and it goes undiagnosed or even unrecognized for a while before it begins to actually show signs and symptoms.
Not
How
only that, not only that, we have medical persons in Scarborough who are discriminating those who have lupus. I have a patient right now in hospital. She has not been seen for 3 days by a doctor. 3 days, and she's a part of the organization here, a part of our support group. And every day she gives us updates. There needs to be education, not just from the ground, but even the medical fraternity. It's unacceptable. It is just unacceptable that you have persons who are qualified. They are medical experts, whether it's nurses and doctors, and you have people being triaged to the medical emergency, and they do not understand that lupus can affect and attack all the organs in the body. And you have some of these same doctors calling some of these patients hypochondriacs, and they're faking, and they're a junkie, and what have you. There has to be conversation to explain, to understand that no two lupus patients are alike. And the treatment for lupus, you have to understand that there is not a quick fix. It's not a quick fix. There is not even a specific drug. Listen to me carefully. Hear what I'm not saying. Do not hear what I'm not saying. They treat lupus and the symptoms. They don't treat the disease. They treat the symptoms. So no two lupus patients are alike. So you may have a patient exhibiting a particular symptom or symptoms, and then you may have another one that is not traditional. You have to understand the complexity of this disease. And it's been far too long of a cry where Tobagonians, those living with lupus, they face so many setbacks at in the healthcare system in Tobago. And I'm not knocking the healthcare system. Forgive me if I sound like I am, but there has to be equity in healthcare, because too many people are suffering. It breaks my heart every time that young lady has to go to seek medical attention. We have patients who have faced abuse when they go before the board for social grants. But you don't look sick. But if you're sick, why you make children? These are some of the conversations that people have with patients. That is just so disrespectful, and it's not right. So conversations need to happen. So I'm so happy, Kayla and Tanisha, they are championing, along with the Voice of Lupus, to continue this discussion so that there can be equity across the board. And we need to stop the stigma, stop the discrimination. Lupus is an invisible disability. We need to get with the program. We need to understand that not all diseases can be seen. And we need to educate from the top, from the bottom to the top. You cannot tell me there are social workers in Tobago who are telling patients, you don't look sick, so you don't deserve a grant. That is nonsense. You can't get the grant because if you're well enough to have children, you're well enough to have a job. That is nonsense.
Understood. But I honestly don't think that that is, systematically how the social grant works. I know from a disability perspective, persons are asked to bring a medical document that proves that they do have the disability, and that is how the process moves forward. But I'm not sure, and then I cannot speak to persons who would have faced that type of discrimination. But
I'm telling you because I understand.
systematically,
Right, the
this
system
the
is that
way
they have to
the
go through the medical. The doctor would sign off on whether they can apply for public assistance or they qualify for disability. And many of them they get the authorization from the doctor. But when they go before the board in social welfare in Tobago, that's where the issue lies. Now,
unders-
not everyone qualifies for disability, but they would be qualified for public assistance, medical public assistance.
understood. And what are some of the things that your organizations is doing right now in Tobago as it pertains to raising awareness?
So, since the pandemic, we stopped coming to Tobago because let me tell you something, no man is an island. And for me, living with lupus, I mean, for almost 8 years, every month I was in Tobago and it took a toll on my body. So, after the pandemic, I had to take a step back and I had to prioritize my health. And the organization would love to have a presence in Tobago. Unfortunately, since the pandemic, we have not been to Tobago. And we are providing whatever support we can to this new support group so that they can have the impact and they can continue to support those in Tobago living with lupus. But there needs to be conversation, as I said, with the movers and the shakers, with the THA, because I remember on the Tobago House of Assembly, chief the chief of the Tobago House of Assembly, Mr. Over London. I remember we were educating and going through all the community centers and what have you. And we had the support of them to do that. And it transcended to us having that impact for about 8 years. But then I could not keep up. I just physically could not keep up.
Totally
So what we
understood.
do So what we do is that we do have a support group on WhatsApp, and there are many patients in Tobago who reach out, and we try as best as we can to have that inclusion. I mean, we just ended World Lupus Day on Saturday. We had a conference virtually. We had medical experts and nutritionists and what have you, and they were a part of the conversation.
And so, do you want to leave the number for persons who are willing to join or want to get engaged with some of the activities that you're doing here?
I would like that persons in Tobago who are living with lupus to reach out to Shades of Purple because they are on the ground and they are the ones who would be able to assist immediately. But if you still want to connect with the national voice and the national organization in Trinidad and Tobago, you can reach out to 327-0220. You can follow us on Facebook and Instagram, and you can send us an email if you so desire, voiceoflupus@gmail.com.
Excellent. And we want to thank you so much for all the work that you have been doing and the work that you're continuing to do as it pertains to lupus awareness and just support for those persons that are battling with lupus. Is there anything you want to say before we leave this morning?
Listen, I think lupus patients deserve kindness, they deserve compassion. Not every disease, not every disability can be seen. And we need to understand that lupus is a complex disease. It's often misunderstood. There are a lot of people living with lupus in Tobago, but they do not speak about it because of the stigma that's associated with living with this condition. There are many of them who are afraid to even whisper it because they don't want to lose their jobs. They're worried about their livelihoods. I just want to say that there needs to remain a pressing need for support in Tobago. My heart is for Tobago. I love Tobago. I believe that there needs to be representation. The island's residents living with this condition often faces challenges, especially in accessing care, lupus care. leading to delayed diagnoses and also inadequate treatment. And establishing this dedicated support group and having awareness campaigns on healthcare services in Tobago would be crucial to ensure that Tobagonians living with lupus are not left behind. And the organization Voice of Lupus, we're also embarking on some services like essential services, vision screening, diabetes testings, etc., stuff like that. It's a multifaceted approach to treating lupus because of the side effects of the medications. There are two main drugs that are used to treat lupus. One is hydroxychloroquine, and the side effects of those medication can potentially cause vision loss. And then you also have steroids, prednisolone. Steroids is known, it's an immune suppressive drug, but it also causes side effects, and one of them is glaucoma, cataract, glaucoma, and other eye issues. So we really need to have that intervention, because I know here in Trinidad, there are patients who are waiting as much as 16 months just to get an eye appointment at the nation's hospitals. And I'm sure that there are challenges in Tobago as well. So we really want to bring that over into Tobago as well, so that it can play a pivotal role in providing tangible support and really giving them a positive outcome at winning and thriving in spite of having this autoimmune disease. So I really want.
Excellent. Ms. Harrilal, we want to thank you so much for your time this morning. We're going to take a quick break right here, and we'll be back right after this. See you soon.
It's a brand new morning.